Hello, everyone. Thank you so much for joining me. Welcome to Laughter is the Best Medicine Besides Medicine, the Case for Medical Clowns. I think today's going to be a fun little presentation, and I hope that you'll learn a thing or two. First, I just want to introduce myself. My name is Aviva Pressman. I may be the only person in the world with this distinct list of qualifications to talk to you about this. So I am certified in biomedical visualization and communication, global maternal and child health, the sexual assault medical and forensics exam. I am also a gynecological teaching associate and a standardized patient. I've been working in medical simulation and medical schools for over 15 years. If I look familiar, you may have done your very first physical exam or pelvic exam on me. I am also a humanitarian clown. I've been working as a clown for quite a long time. Now, what I am not is a doctor, though I also play those in medical schools pretty often. So why should you listen to me? Of course, a clown wants to put clowns in hospitals. That's not a reliable source. So don't listen to me. Listen to other doctors and healthcare workers. 9 out of 10 healthcare workers said hospital clowns had a positive effect on their patients. That's a pretty general number. So let me also give you some specific quotes. Dr. Roy Kimball of Australia said, "We can't get enough of the clown doctors. I'd have them here all the time if I could." And that's something you hear a lot, is that doctors who originally said, "I don't want a clown in my hospital. What? That's chaos," now say, "I don't want to go to the hospital without a clown." And one of the main reasons for that, I think, is summed up really well by a physician at Davidoff Oncology Ward who said, "I want to think that I don't neglect the mental aspects of the patient, but I for sure sometimes do because this is a very busy system. So I think the medical clown helps with the aspect that can sometimes be neglected or pushed to the side." I know I work with doctors all the time, and I know that you all really want to be there for your patients mentally and physically. But sometimes you have to run out of the room and save somebody's life. And the clown is someone who can really pick up the slack on that, and that's something that these doctors have noticed. Dr. Shevach Friedler called the intervention one of the least hazardous interventions in our field, which is true. There's not a lot of clown-specific infections that your patients are going to get, though I came up with some. Rubber chicken pox, whoopee cough, clown conjunctivitis, and bubonic plague. That's the end of those. Don't worry, there's no more. Okay, so doctors like clowns when they work with them. Great. But what do the actual numbers say? What does the science say? We're going to talk a lot about that today. So it's been studied the most in the pediatric population. And a lot of times, most of the studies have talked about anxiety and pain and reduction in crying for kids undergoing different kinds of things that are difficult or painful. There's also a lot of studies in terms of their parents and the reduction for their parents in terms of anxiety. That's been studied in all different kinds of scenarios, different age groups, and different countries. They've even shown that kids do better with certain medical tests after they've seen a clown. So whether that's because the clown helped them want to adhere to things, or because they laughed and the laughter and the breath going through them was good for them, we don't actually know, but we know that it is an effective intervention, which is pretty cool. So I don't expect you to read all those studies, but I read them, and there's some things that I think were really interesting. First off, I want to note that when we say clowns reduce anxiety and crying in things like blood draws, that's not compared to a kid with no intervention. That is compared with kids who had EMLA and other topical medicines to reduce pain. The kids who saw clowns did not have that and still had reductions in pain and anxiety. Clowns are also long-lasting. There was a study where kids had to get botulinum toxin injections. So it's a series of injections. And the children who saw a clown on their first injection had reduced anxiety for each subsequent injection because they had a positive association with the clown from the first one. So clowns, long-lasting care. Also, they cause shorter hospital stays. They've done several studies where doctors didn't know which of their patients had seen a clown and which of their patients hadn't seen a clown. And on average, they discharged the patients who had seen a clown 24 hours earlier than the ones who hadn't. So that saves money. It's better for patient satisfaction. It's going to be better for the kids' mental health. And it's going to just make your hospital look better because the kids aren't there for so long. So very cool things from a lot of those studies. Here's the thing though. A lot of these just have to do with something positive or just distracting a kid. Arguably, can't anyone distract a kid? Yes. I'm gonna fast forward because it just goes on.
Oh, that was cool.
So long. Oh, good. An encore. Yeah. So if a mini horse can do that, what makes clowns so special? A woman named Professor Carnielli Miller studied just that. So she went into hospitals and studied medical clowns and watched them as they worked with a whole team of researchers. Here's what they found. They found 40 distinct skills that they could name that medical clowns brought to the table. Remember, these are not just people in clown costumes. These are people who are really well trained. They have specific verbal communication and nonverbal communication skills that they use. And using those 40 skills, they're able to achieve different and specific therapeutic goals. Some of the ones they identified were connecting to patients and their wishes, dealing with patients' emotions and difficulties, enhancing motivation for treatment adherence, and increasing a sense of control, caring, and encouragement. And they actually identified something that most clowns could already tell you. And that is that the medical system feels really hierarchical to patients, even when you don't want it to be. They feel like the doctor is in charge and they're supposed to do what the doctor said, or they're being difficult. So one of the skills of a medical clown is that they place themselves in the lowest position in the medical setting, lower than the patient. If the patient is clumsy, the clown might be clumsier. If the patient doesn't want to do something, the clown is even more scared of it. Perhaps. These are different kinds of tools that they can use. But either way, the patient can boss around the clown. The patient can tell the clown what to do. And they even found that kids who said, "No, I don't want to see the clown, go away," that they had more courage to face their challenges because they were allowed to say no in a way that they can't with a nurse coming in to take their vitals, for instance. So that low status of the clown really gave these kids and also gives adults a sense of power and control in these medical situations where they can feel so out of control. So it's because of all these skills that clowns can deal with a lot of things that a mini horse cannot. For instance, clowns can work with kids with intellectual disabilities, and those kids have showed greater improvements in socio-emotional abilities because of the sense of play that they get. Also in sexual assault cases, they've worked with kids ages 1 through 17, so a wide age range, in a sexual assault clinic. And the kids showed less fear, they reported lower pain levels, and they had fewer invasive thoughts. In addition to that, the doctors on that study reported that they felt less likely to re-traumatize a patient in an invasive exam when a clown was present. These exams are so long and they can feel invasive and traumatic even when done with the best of intent, and clowns can be really helpful to doctors in that situation. Also, small children who have to stay still. 94% of pediatricians said that medical clowns help them to even be able to complete a physical examination on toddlers, where a lot of times they have to give up on certain parts of it. And on top of that, children who had to stay extremely still for kidney imaging were paired with clowns in a study. And the hospital that did this, they used to have to sedate 100% of toddlers who had this exam because no toddler could stay still enough. Now they only sedate 5%, and the only intervention they've done is adding clowns. So pretty cool. Another way that it's going to save you money and have better patient satisfaction. So the last one is that clowns can handle adults, which are arguably harder than children in some ways. This has not been studied as extensively as pediatrics, but where it's been studied the most is geriatrics, which makes sense because there's some parallels, right? I actually have a recent experience with this where I went in to an old age home and I was providing some clowning. And what I found was really exactly what I read in the studies. So in the studies, they talked about community, the sense of community. And when I walked in, everyone was kind of sitting on their own, looking down in their own thoughts. And then as time went on, people started talking to each other more. There was a man who kept coming up to me and looking confused. He didn't know who I was. But then he would see all the stuff I had. And he would notice the face paints. And I would say, do you want a face paint? And he would say yes. And he would think about it. And he would say, a mariposa, right? A butterfly. And so I painted a butterfly for him. This happened 5 or 6 times. And every time he'd think about it and then say, a mariposa. And he was just covered in butterflies. And when I left, he was so excited about the way he looked and what he had gotten to do. He was going around to everyone and showing off his butterflies. People were talking about the magic show we did. People were wearing their balloons and taking pictures with each other. There was a sense of community that was created that they find it with clowns. That happens in geriatrics more than it happens in things like art therapy, other really wonderful artistic interventions that don't have the same sense of play. So another place that this has been useful, an IVF clinic did a study where they paired IVF patients with a clown for just 15 minutes right after embryo transfer. Those patients who saw a clown for 15 minutes were 2.67 times more likely to have successful fertilization, which is insane. And this is from the 2011 American Society for Reproductive Medicine. So this isn't just like some weird little study, but if you don't believe it, repeat it, see what you find, right? And then the last one I want to share with you is that the intervention of clowns reduced attempted escape, self-injury, and fighting in psychiatric wards. Which is just like another way that you can have so many different populations that will respond positively to clowns and playing clowning, right? So we reached the end of our presentation. Thank you so much for being here and for listening to Laughter is the Best Medicine, sometimes including medicine, the case for medical clowns.